I'm Dr. Robert Spalding, and we're going to talk about diabetic foot exams. So we have a patient here that is a diabetic, and one of the first questions I ask them is, are they controlled with their sugar? And that means, of course, blood sugar. And the other thing I ask is, what is their A1C ratio, so that we know how well he's been trying to. And so I'm gonna have the patient respond. What's been your blood sugar today or recently? You said 113?
Yes, sir.
Okay, and then what's your most recent A1C?
6.3.
Okay, now as we look at his feet, we're looking for any kind of edema, marks, or lesions. So what I do is I put pressure right here on what's called the pretibial area of the leg, and I see if there's any kind of swelling. And of course you can see there's probably what's called, on a scale of 1 to 3, +1, almost going into +2, but you can see that if I press here, it leaves an impression. So I'm going to be suggesting to this patient that he uses compression stockings to help push this fluid back into circulation and help reduce this, because if you have swelling here, you may have swelling down here on the foot, and that can put pressure on the vessels and the nerves, and that alone can cause discomfort in some people's feet. So now we're going to start taking a look at the overall condition around the heels, the dryness of the skin, and they have now come out with a device called a thermostat device that measures how much moisture is in the skin, and you would place this with the tips on the skin here and measure that and determine through their graph what is the amount of moisture in the foot. So this is a thermostat. This is kind of an interesting new tool that we're starting to incorporate. Some other things that we're looking for, of course, once we determine that we have the nail situation, are we having any redness or any irritation? We're also looking for between the toes, what could be possibly occurring down through here. Now, many times we're going to need lighting to help us. So this again is where this Aerovax unit comes in useful, and I turn this on to give me additional lighting to see what we can really see. And we can see that there's a little bit of material in here, and when we start seeing material hiding things, we want to clean this out to make sure we don't have any kind of lesion. So we take a 3x3, and what we always use around here for our surfaces and for skin is hypochlorous acid. We'll either wet this or wet this area, and we'll clean this out so that we can get a good visualization of this material hiding what's going on, and now we can determine that there's no lesions or cracks in between the toes. So that's very helpful. When we start looking at you can see where previous nail surgeries have been done on this individual. You've got a little bit of return of nail in this corner and on the other foot. You can see some dryness on this area here. We're going to ask you, have you been using any products on your feet? Okay, so naturally they're going to be a little drier because he's not using any products on his feet. We would then suggest some things that have worked in the past. One of the things that we use a lot around here is Poto Expert, but a lot of times we're also checking to make sure there's no cracks or crevices, so we'll put a little of this hypochlorous acid on, and sometimes that'll expose some other issues that are sometimes hidden. So again, some of these areas are hard to determine just by visualization, so you have to rub your hands over it, feel if there's any cracks, and look for that. One of the basic things that we do as part of this initial survey is that we check for pulses, and you check for the posterior tibial pulse right here back in this triangle that's called, there's a triangle right here, and we find the posterior tibial pulse that's coming down through here, and we measure how much pressure that this is producing, or if we can determine that there's a pulse at all. If we have a little trouble feeling that, we also want to check this area here for a pulse called the dorsalis pedis. And if we can't feel that, we're going to use a Doppler. Now sometimes we'll have to turn this off just to use the Doppler. And what we'll do is put a dab of this electronic gel here and right over here. And we're going to turn the Doppler on and try to test for a pulse. And if we can hear it, then we know that we've got good pulses. Now his foot is warm to the touch, so we know he's getting blood flow. We just want to measure the character of this particular pulse. If we reposition the foot sometimes, we can hear a little better. Sometimes it's a real expedition. There we go. You can pick up. You can hear two sounds. So it's lub dub, wish, 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 wish. Two sounds mean biphasic, so he's within normal limits. Over here, we can pick up the same thing, two sounds. It's a whoosh, 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 whoosh. Anyway, those are sounds that tell us that we have biphasic. The other thing we're checking for is capillary return. So we press right here. It turns white because we're pushing all the blood out. And then we start counting how quickly does that return. And it was almost instantaneous, certainly less than a second, which is exactly what you want to see in a healthy vascular foot. Now, I said it was warm to the touch. We're going to wipe off this gel, and we're going to wipe off this device and get it out of the way for the next patient. And we're going to check the temperature of the foot. There are several devices out. We were probably the first ones to start using IR thermometers. There's a lot of different ones out here. This one is IR stat. I use just a conventional one as well, just to get a general temperature range. I check the toes. That's 91. Actually, that is probably almost getting close to what's called a reverse gradient. Normally you're in the 70s, mid 70s, around 80, but his is almost as much as a temperature of the hands. The hands usually are about 10 degrees. If you hold it the other way, there you go. The hands are 95. Usually there's a 10-degree temperature difference between the hands and the feet. So his feet are very warm. They're getting lots of blood flow. The next thing is that we're going to talk about what is called a Weinstein filament. These are a 10-gram monofilament. There's 10 grams worth of pressure. They call it a Sims Weinstein, or a Weinstein filament, we do for short. And we just test with his eyes closed, does he feel these areas? We want to test them in several areas. On the top and bottom of the feet, back around the heel and the arch. So we test them in at least 5 different areas on each foot. And if you'll close your eyes and tell me, where am I touching you right now?
Left foot, ball of the toe.
Okay, left foot down to the ball of the foot. Can you tell me where I'm touching you now?
Arch of the left foot.
Okay, and now, and again, what we want to do is put pressure on it. We don't want to do what you saw me doing a while ago, touching. We want to put pressure and then bend that filament. That's usually around a 20-pound test line filament, and ask, where am I touching you now?
Right first toe.
Okay, so everywhere I've touched him, he's been able to determine this. And so we're going to put our Weinstein filament back up. Now, There are a lot of other products out there now. Here's an electronic device, an ETF, that will measure by vibration different aspects of what's considered neuropathy. Now you can do a similar device with a hammer, a vibratory hammer. When you hit this on your hand and you start that vibration, you put it on an area of the foot and ask them, can they feel that? And if so, when does it stop? Now, the electronic versions, and there's even another version, it's a little bitty one called a Vibratip, where you squeeze this on, it starts to vibrate, and you ask them, can you feel that?
Yes.
And if you can feel that vibrating, and that's another way of doing the same thing as all three of these devices will do. So we've gotten through the vibratory, and the reason why vibratory is so important, it's the first sense that you tend to lose in neuropathy. So if you can't feel a 10-gram Weinstein filament, you have a more serious problem than if you just can't feel vibratory. But vibratory is the first sense to go out, and that's why that's important. So these devices, like the vibratory hammer, testing where you can feel it and when it quits vibrating, because many times with people with neuropathy, they can't even feel it vibrating, and then sometimes they may not be able to feel when it stops. So sometimes it's absent, sometimes it's diminished, and sometimes it's just normal.